Well, good morning, everyone. I hope these campus updates continue to be useful. This is really part of our communication strategy. It's easy to overlook emails, and texts are really not that useful for us. And we want to make sure that we have good horizontal and vertical communication within the institution and an opportunity for those of you who are interested in asking questions. I know that this is an interesting time in higher education. There's a lot taking place both nationally and at the state level that people have uncertainty around. So I expect we'll get a number of questions in that space at the end of the presentation. And both me as well as other members of the team will work to answer those questions for you in most transparent and our best capable way of doing so. But there are many unknowns for us too. I do want to recognize the number of our researchers and program leaders who continue to bring money into the university to support great causes. This is the reason dollars come in, is to support our mission, and we're fortunate to be able to receive funding from outside organizations. So congratulations to Dr. Civic, to Rusamara, who always is on this list of people receiving additional funds from the outside, Ms. Steiner, Dr. Kosiba, and Jessica Zavala. We appreciate everything you do, and this is just great recognition from somebody outside the institution recognizing the quality of work that you bring to NEOMED. I also want to recognize our Dean of the College of Pharmacy, Dr. Kat Trump. Dr. Trump was recognized as the chair for the big Northeast Ohio American Heart Association event, which is focused on heart disease in women. And so it's Northeast Ohio's Go Red for Women chair. Dr. Trump, congratulations for this recognition. We're also going to be honoring our alumni, and the Alumni Association also likes to recognize leaders within our organization who've contributed to the university and to the success of our alumni. And so this event will be coming up in April. It's an opportunity for us to bring our alumni and former leaders back onto campus, recognize their great work, and if any of you are able to attend and to join in that recognition ceremony, we'd love to have you there. We have 2 College of Pharmacy students who are moving on to postdoctoral fellowships. These are really prestigious nationwide fellowships. The first is Diana Morris, who is receiving a postdoctoral fellowship in the SkinCeuticals group, and then also John Rensel, who is a PharmD candidate for 2025, who's going to have a fellowship at Genmab, which is a huge company that's doing great work nationally. We talk about the College of Medicine's match ceremony very frequently. It's a big day in medicine, but it's one day, and so it's easy to recognize that event. I think sometimes we forget that the College of Pharmacy goes through this same process, and it is a very competitive process, but they stretch theirs out over 2 phases. Instead of having a single day to recognize the success of their graduates, it's stretched out over a period of time. A little harder for us to be able to celebrate that way, but I do want you to pay attention to that match. We are one of the top colleges of pharmacy in Ohio for our match rate, and it shows that our students are highly competitive for these very prestigious spots that they're competing for. College of Pharmacy is also very engaged with advocacy. And for those of you who aren't familiar with the power of advocacy, this is a really important aspect of what we do every day at the university. The state of Ohio and the federal government are both key stakeholders for us. So we spend a lot of time meeting with our legislators because our legislators learn about the importance of our programs, the importance of funding our programs as a state institution, and then they receive input from us and hopefully from you on programming that affects the institution through new legislation. So the College of Pharmacy every year brings a number of their students down to learn how to be advocates. And this year they brought 12 down to meet with our legislators to explain what a pharmacy student goes through and the impact that pharmacists have in the state of Ohio. This is a key leadership experience. Our motto is creating transformational leaders, and this is one way that it's being built into the co-curricular curriculum for those students. So really important thing to do, and I think it's important that all of us do this. Now, it's part of my job, so I spend a lot of time in Columbus advocating with our legislative leaders, but the more they hear our voices, the more they understand its importance. From the College of Medicine, I'm pleased to be able to recognize Zara Shah. Zara was recognized, this is a national recognition from the American Medical Association, as a rising star. So this is a big deal. This is the second one of these we've had in just the past few years. And it's just an example of the transformational leaders that are coming out of this university and the recognition of their leadership capacity before they graduate. So big congratulations to Zara. I did also want to recognize that NEOMED has finished its very first cohort in something called Health and Wellbeing Coaching. This is a national program that has received funding through CMS, so the Center for Medicare and Medicaid Services, as a provider. And that provider can receive compensation and utilization through health systems. Much like a physician, a pharmacist, an LPN, this is a part of the healthcare team. We are nationally accredited as an institution to do this and provide this certificate. And we have been training in our initial class students that university hospitals have been paying for them to go through this program. It is currently under our executive education program. I do want to recognize this team, though, because they have done something amazing. We have been the first in the nation to incorporate all of the clinical coaching elements that are required to become licensed. That may seem to be common sense to some, but no other program does this. So you go through all your educational elements, and then once you finish those, these students are required to go out and find their own patients to coach, and then to be able to document what they have done. We set them up for them, and because of that, the national accrediting body has recognized our work and is now going to mandate this for programs nationwide. So it's just another example of how the university is leading and how the national bodies are recognizing the great work that we're doing. So I want to thank the entire team who stood this program up, and they're continuing to move forward. As I think we're starting our third cohort soon, and we have also already moved a number of our students through the national accreditation testing. So the match program I brought up with the College of Medicine, that big day is coming up, but some students match early. These tend to be very, very competitive match programs because they want to offer students who didn't get into the really competitive ones a chance to be able to enter the national match in another field. We have been highly competitive for these. Urology is one of the most competitive specialties in medicine, and we had a great match this year with 3 of our students going into it. And of course, we know that one is going to be going to Akron General, which is wonderful. They're staying near home. Another, the University of Cincinnati, staying in the state of Ohio, and then one who's going to be nearby out in Virginia. So congratulations to those students. College of Dentistry, and we talk about it a lot because it's our newest college that's standing up. I will tell you that we are now full. We'll see if it stays that way. There's always a little melt, but we have 52 students signed up for our 50 spots. We'll also have a wait list group of students. So we are full and our numbers look amazing. If you look at the quality, the caliber of the students who've already committed to the university, their numbers are equal to the quality of the students that are going into Ohio State University and Case Western Reserve. So they're seeing the quality of our program. They're already coming on board based on reputation because we have no history for them to look at how our program has done. So this is a group of innovators who've looked at NEOMED and said, I'm going to trust you with my education because of the quality you've had with other programs, and we're really excited to have them join us. Dr. Frank Beck stepped up in a big way for this university. He came in as our inaugural interim dean, which we had to have in place for our accreditation process. Dr. Beck has been absolutely amazing. He's helped us get through the accreditation process, fundraising, bringing in the gift from the Batante Family Foundation, and he continues to be an advocate driving us forward. He's been engaged in bringing in faculty and chairs and working with the provost in the hiring process. We could not have done this without him. But he had made the decision not to apply for the formal dean's position, and so he is helping us through that process also. And he already knows the expectation is he's going to stay engaged and involved with this university even after a new dean comes into place. And we have two top candidates who've gone through a lengthy process. And today we'll be doing an interview, and you will have a chance to be able to hear from and have community comment on Dr. Kristen Victoroff, one of our two top candidates. And many of you know Dr. Victoroff because she's also an internal candidate for us. The other who will be interviewed this week is Dr. Tyke. Dr. Tyke is coming to us as the James Edward College of Dental Medicine at the University of South Carolina. Another highly qualified candidate. We have two outstanding candidates for our dean position. So please attend if you can, weigh in. We want to hear from you. The goal for us is to pick somebody who's not only great, that both of them are great. We already know that they've met that bar, but who's going to be the best match to propel our College of Dentistry forward? And it has to be somebody who embraces the culture that we have here and that we are continuing to create here at the university. It'll be a little bit slower on campus from March 2nd to 9th. It might be easier to get into the Starbucks line if you're a coffee drinker because our students will be on break. We are still here as we catch up with all of the requirements from teaching when our students are on campus, but this does provide us a little bit of an opportunity to refocus on making sure that the semester is going well and planning for what's coming forward across the next couple of months at the university until we move into May and we go through our commencement ceremony, and then we have the great privilege of going through it all over again, right? We're on a cycle where we do great things every year and we have our milestones, and certainly things like match day and commencement are really big days for the university. We also spent a lot of time surveying faculty and staff and students. Many of you met with us in open forums, and one of the things we heard quite a bit was these forums are great for identified question askers. So when you ask a question, we know who you are, and for those people who want to do that publicly, I think that's a declaration that you're willing to get up, ask the question, and have everybody know where that question came from. But not everybody feels comfortable doing that, and that's okay. So we've set up a website for you to go to now. It's called Suggestion Box. It is de-identified. It's so totally anonymous. We don't know who's asking the questions. And you have the ability to ask questions or to give feedback. Or if many have said, hey, why don't we get an opportunity to give comment on some of the services at the university, whether those services are student services, finance, operations, the great police department that we have here, IT, or HR. It's a chance for you to be able to make comment. I do encourage you to make these more than just, here's something that needs to be fixed. If you see a superstar in the organization, tell us about it. We'll make sure that they know somebody recognized that they went above and beyond in their position. I think it's more important that we have this as a holistic approach to feedback so that it's not just focusing on what you want fixed, but also focusing on what you want us to stay focused on, the things that are working really well, and then recognizing the people on our team who are doing this great work. Employee recognition ceremony is coming up on March 7th. There will be hors d'oeuvres. We encourage all of you to attend so that we can celebrate the people who bring this campus together and allow us to be great academics, to be great researchers, and to contribute to our local communities, because it is the people that make this happen. Many of us have the privilege of leading and helping to make decisions, but the only reason we're here is to support you. That is the whole purpose of my position. That is the whole purpose of the provost position, the senior vice president for finance and operations, our attorney, our folks who lead the organization strategy, vice president for research. All of us are here to serve you. Without you, we don't have a job. So it's our goal to recognize those of you who are great. I know all of you do amazing work, but some have been recognized by their peers for special recognition because they have done so much more for this university and for the people within it. We're also continuing to build on our staff and faculty development. The strategy office built out the Employed Empowered Excellence program, and it has been one of our most popular programs at the university. Many of the classes become overfilled, and we offer a second opportunity to learn from the programs that they're building. The ones coming up soon are Outlook tips and tricks, data-driven planning and choosing the right metric, and strategy 101. So if you have an interest, we encourage you to attend. And of course, these are noon to 1 so that everybody has an opportunity on campus to be able to attend if they'd like to. I'd also like to welcome Laura Good to the university. Laura is the new Executive Director for Human Resources. She has been charged in working with our Human Resources team, who holds us together and works to make sure you're onboarded, you have your benefits, and that you're being taken care of. And she's coming in to lead the organization to bring us to a higher level of service. It takes a leader to build their team and to benefit from each of their individual strengths to pull them together into a higher performing team than they already are. So thank you. We look forward to having Laura here. And there's a celebration on March 18th for you to come together to learn a little bit more about her, to mingle with her and welcome her to our community. Vitals continues to be a great program for us. I've talked about this a little bit before, but the American Medical Association has now executed an agreement with NEOMED, and we will be part of their Ed Hub. So Select Vitals in our Vitals website will now be available to over 600,000 clinicians nationwide to be able to watch, to learn, and to gain free CME from the opportunity. So it'll drive a lot of traffic in our direction. I want to thank Tanya Stong-Charles and, of course, Maria Scheimer, who helped us through this process. And we're really excited to get this off. This is going to be another big name-building event for the university so that more people can see the great work that we're doing. Dr. Singh will be our next speaker. He's currently the Vice President and Chief Medical Officer for the Cleveland Clinic, North and South Hospitals, which I understand are down in Florida. So this will be a welcomed opportunity learn a little bit about how healthcare is being advanced in a region outside of Ohio. And then Neovations Bench to Bedside. This is our fourth year that we're going, sorry, this says fifth. I thought it was our fourth annual competition. This takes students from across disciplines. So medical students, pharmacy students, graduate students, engineering, design, law, and business. We bring in a collaborative from all the universities in the region and outside. They work with a clinician to identify an unmet medical need, go through brainstorming and ideation, create a new solution, have to develop a functional or at least a proof of concept prototype, go through the patent landscape, ideally file at least a provisional patent or develop some type of trademark or trade secret around their work, and outline their regulatory pathway to get through the FDA or what that pathway may look like, as well as a full business plan. We've had several patents filed from this program over the years. We've had student teams working on developing new companies. And the goal isn't just commercialization for the sake of it. It's commercialization of technology so that we can improve healthcare, whether it's access, quality outcomes, or affordability. We're trying to use this to drive the creation of future healthcare leaders as they get a better understanding of how we use technology and how important commercialization is for that technology to actually get into the hands of clinicians to make a difference. This year, we're expecting participation from the University of Hawaii, who's going to send teams out along with students. The University of Utah is sending 3 teams out, and we've been working with the National University of Singapore to see if they can get a team here this time. If not, the intent would be they will be doing it next time. Dr. Safadi has been helping to lead a group of student leaders who are building this program out for us. Would love to have you join us for Neovation's Bench to Bedside this year. It's always held at the university. There's always hors d'oeuvres and beverages served, and your vote counts. You have the opportunity to go listen to the student pitches, get an understanding of what their ideas and their solutions are, and then we do a best program recognition, which is kind of what did you think of those students and who do you think is the best team? Another transformation leader, one of our graduates. We highlight our graduates all the time. Dr. Terry Lash-Ritter is a graduate of Northeast Ohio Medical University, and she has just been named as the Southern Region President for the Cleveland Clinic, which means she is in charge of Akron General Cleveland Clinic, our second largest rotation site for our students, but she's also in charge of about a total of 4 hospitals for the Cleveland Clinic. We're seeing so much leadership at the Cleveland Clinic and university hospitals and Mercy Health from our graduates, and this is just the newest. So we're looking forward to watching her serve and watching her have big impact. Mr. Jim Dickey, for those of you who don't know him, he has now stepped down as CEO of Crown Equipment. He is a very generous philanthropist in the state of Ohio and nationwide, and he has become a friend to the university. Mr. Dickey made a $100,000 donation at commencement eve dinner last year just to recognize his dear friend who has served us for so very long, Mr. Paul Bishop. Since then, he's an art collector, and he has donated 11 pieces of art from an artist, Robert Hagen. All of those are on display up in the president's office area down the corridor. We invite all of you to come up and view them. We have them in that area now because these are valuable paintings and it's a secured area, but we would like for all of you who are interested to come do a walkthrough and see these paintings when you would like. He's also making a donation of another painting we just learned about 2 days ago, which will be arriving and will also be hung up at the university, likely in a different location. So a big thank you to Mr. Dickey for his generosity. And commencement this year is May 3rd. May 3rd, we'll be hearing from our speaker, and I'm pleased to be able to tell you that we've received an acceptance from Dr. Frank Pepe, a graduate of Northeast Ohio Medical University, the chairman of dermatology and plastic surgery at the Cleveland Clinic in Cleveland, and he is the leader of the first full face transplant to be completed in the United States. Not only that, but he's an entrepreneur and an innovator who has started companies around new technologies multiple times, the same type of leader and the same type of technologies that our Bench to Bedside program, or our Neovations program, is doing. This should be a very busy commencement for us, certainly will be our largest graduating class. And we're really excited for the opportunity to recognize Dr. Pepe. And after our board meeting, we'll be able to announce who honorary degree candidates are that have to receive board approval in order to be able to do the announcement of their names. So with that, I'm going to stop and open it up to questions. I'd like to start, though, first with the group we have here in the audience. Nobody. Okay, well, let me see what we have online. You spoke about advocacy with state legislators. How have you highlighted the importance of providing students with the acknowledge and, I think it meant to be knowledge and skills to address health inequities, such as the increased Black infant mortality rates that exist across the state? So when we meet with our legislative leaders, we always emphasize the impact that we are having and our students and our faculty are having on populations that are underserved, social determinants of health. Our legislators recognize the importance of this. Our governor recognizes the importance of this. There are a lot of state programs out there to fund specifically this program. What you may be referring to are some of the actions that are taking place at the state level regarding equal access to opportunities in education at the university. None of those are aimed at this. We continue to serve the underserved populations in the region. And in fact, there will be an announcement coming out that NEOMED, university hospitals, and other partners, such as Akron Children's, will be building out we haven't named it yet, whether it's a center or an institute, for maternal health and infant mortality that will focus on these big challenges that we have in the region. In fact, we're holding an event called the Ideator that's really going to kick this off. And the Ideator is going into year 3, but the Ideator brings leaders from around the region, healthcare leaders, administrative leaders, people who bring a diversity of thought to the process to figure out new solutions that can be implemented, track the metrics, and then set as benchmarks for others to follow in the region. So when I've met with legislators, and I meet with them quite a bit, they have recognized that social determinants of health are a real and a critical thing, and that we have to do more. That is different than what they're telling higher education we need to do, and our focus on providing an equal opportunity to all people who come to this university and determining what resources we establish to help everybody be successful. That's the message they're giving us. You need to help everybody be successful equally as a state institution. Can the school detail its plans in relation to SB1 and address enforcement of letters and bills not currently in law? Fortunately, most of SB1 does not have any new impact on the university. Maria Scheimer is going through the bill, has looked at the latest iterations. She is our general counsel who helps us interpret law. She meets with the IUC equivalents in general counsel at all of the other institutions. And here are some of the key things in SB1. One requires a focus on what the legislature is calling faculty performance. Well, everything in that bill regarding annual performance reviews, post-tenure review, faculty workload policies, we're fully compliant. Everything we have is already compliant with the SB1 bill. In fact, others are writing us to say, can you send us what you have? We want to learn from you and possibly just adopt what NEOMED has. The elements that are a little bit contentious right now, too, are the anti-strike clauses. But NEOMED has no unions. So because we have no unions, that clause does not apply to us, and we don't have a concern with its implementation. Most of the elements regarding diversity, a lot of those have already been laid out by the Supreme Court. There's just things that we can no longer do. There are elements in there that say you cannot favor one group over another group. So as the university presidents came together to interpret those elements of SB1, it essentially what we're saying is we're going to create resources and programs to favor every single one of our students based on them as individuals, not based on them as a member of some defined group. And so we're committed to doing just that. Yes, there are some nuances to that rule that Maria is helping us to interpret, and they will have a little bit of impact, but it just means we need to step up and help every member of this organization. And they're telling us you can't favor one group over another group. The the Department of Education also sent a notice to all of the universities across the country. It was a week ago from Friday, from the Office of Civil Rights, which also said you may favor no group in any way based on race. If you do, we're going to audit you, and you're at risk of losing your federal funding, which would shut us down. It doesn't mean grant funding only. It means students couldn't get financial aid to actually attend school here. So we're going to be compliant with the law, as we have to be, but we're also watching all the legal action taking place. A lot of these things have been put on hold, and many of them will be up at the Supreme Court for a final determination. Right now, we're okay, we're compliant, and we're going to continue to be compliant and do what's best for our students, our faculty, and staff here at the university. Let me stop for a moment. Looks like we have a question in the audience.
Hi, my name is Cayman. Nice to see you again, Dr. Langell. I'm an M2 student here at NEOMED. I also serve as the president of Student National Medical Association, and I've also been in attendance, and I'm pretty visible amongst the staff. I try to make myself. So I just had a question, as it pertains to, there's a lot of going on with DEI, and as a minority student, as a woman, I'm concerned. Um, a lot of our club's funding has been pulled, and I feel personally impacted by that because we had a lot of things planned, obviously, for this semester, and then our advisor told us that we can't do any of it because we don't have funding. So I guess I'm just wondering, as a student, feel left out of the loop. As you know, our first priority is to be a student. And I'm trying to do that, but also I feel like there hasn't been a lot of correspondence about what's going on behind the scenes. And then also I heard we were supposed to be going to a conference in April. Funding was pulled for that. And our advisor had to tell us last minute, funding's been pulled. Now you have to figure out. So now people have paid for their tickets, have done things already to try and prepare for this, and it's very abrupt. And as a student, I feel even more stressed out because I don't know what's going on. So I was just wondering if you had a plan or something to let us know as students what's going on, as well as it affects a lot of us, not only does it affect minorities on campus, it affects women, it affects pretty much, and that's a large population of our students here. So I was just wondering if you were planning on releasing a statement about funding, so that I would have much preferred to hear that from you guys first, and then maybe how it trickled down to our club. So I was just wondering if you had intentions on doing that.
Yes, Cayman, thank you for the question. And if it seemed abrupt to you, it was also abrupt to us. We just learned about this on Friday. And so I spent a lot of time on a phone call with legal counsel, who's also been working with legal counsel from across the state. And the interpretation of the current letter we received from the Department of Education federally said you may not do any of these things. And it wasn't, this one is only focused on race. It wasn't focused on gender or gender identity or ethnicity, but they said you will be compliant no later than February 28th, correct, Maria? 14 days. February 28th, and they said this is a grace period that really this should have been the law all the time in their interpretation. They've also identified multiple institutions in Ohio who are supposed to be audited for this within the next 40 days. And if your audit shows any violations, you risk losing funding from the federal government, including your ability as a student to get financial aid. So this came very abruptly to us, and we had to figure out what to do with it. And it's a challenge that we understand. In this case, the college dean tried to do something very helpful for the students to say, you buy the tickets, we'll take care of the airfare, and we'll get your housing. Well, they did due diligence. The airfare is committed. We can't undo it. That's in place. You are free to go. We're just being informed that for now, anyway, and meeting in April, we can't pay for the hotels. It doesn't mean you can't go. The airfare is still there. And this may get changed or undone before April. And if we're legal and compliant, then the dean of the college will continue to support the efforts that he tried to make a commitment for. This was outside of his control. We're also watching SB 1, right? Senate Bill 1 did go through the Senate. It's very much expected to go through the House and be out of the House by the end of March, is what we're told by the Inter-University Council, and will likely become the law of Ohio effective July or August timeframe. So there's a lot that we're watching, and there's so many nuances and so much change that working with Maria, it just hasn't, there's nothing I can give you definitively. This has happened very, very quickly to us. When we really understand, we can put out some language to be able to share as a message. For now, what we did is we asked the deans, if this impacts your students, can you please go meet with them right away and explain to them what's going on? So, Maria, did you have anything you wanted to comment on regarding this?
Putting out a matrix that'll be showing you who's affected, what the effect is, what the effective date is, and what we were, who's going to be responsible for doing what. So we welcome you to come and ask us anything that you would like to have clarified in advance. If you have concerns, I've already addressed a number of concerns from the faculty and from some of the staff. But we want to continue to address your concerns in a proactive way. And again, we will present that matrix so that you can look at it and you can say, okay, here's my program, here's how it affects my program, here's what I need to do, here's the report I need to write, or here's the behavior that I need to change. So we're going to try to have that available for you as soon as we have a final version of the bill and it becomes law.
Thank you. Now, when we meet with the legislators, here's what they tell us. We want you to ensure every student, regardless of what population they identify with, is getting all the resources they need to be successful. So each of us is made up of different elements that make us unique. We're being told we're not allowed to focus on one population over another population. For instance, we cannot give benefits to somebody because they are a biological female when we're not giving the same resources to somebody who is a biological male. And I say it that way because the bill also includes a recognition of only two genders, right? So that's what they're telling us. And we are here as a state institution to try and support everybody here. And what they're saying is support everybody, give everybody the resources they need, but don't do it for one group over another group. And so that's what we're doing. We're just stepping up to do so. Dr. Faison, under the provost office, is building out the teaching excellence program, the learning excellence program, supporting all of our students through student services. And we're going to continue to do that and to build the opportunities to make every individual here successful.
Hello, my name is Carlton Cherry. I'm P2 here at NEOMED. My question is more so related to how this will affect admissions within the next coming years. The main area of concern that I have is what practices will NEOMED have to ensure that the demographics of the people who are admitted are reflective of the population of Northeast Ohio?
Thank you, Carlton. I appreciate the question. So I can address where we're at and what we're doing. So we've been told we are not allowed to focus by the Supreme Court of the United States. You can't focus on race-based enrollment. That's gone away. However, we are allowed to focus on things like resiliency. So what has that individual student overcome or had to overcome to get here? And that's a metric that's being adopted nationwide right now. And so resiliency is a key element. In order to meet the requirements of the law, diversity at the institution has now been defined to meet certain aspects of Ohio's requirement. And that is rural, educationally disadvantaged, and U.S. military affiliated. So educationally disadvantaged can mean a lot of things, right? It's taking the individual into account. And resiliency as the component of that could say, somebody grew up as a member of a certain population living in Appalachia, had no access to high quality education because of the region they were in, was economically impoverished. And so that person's resiliency to overcome those experiences allows us to focus on them and bring them in and to give them merited weight for what they've had to overcome. That same thing may exist for somebody who grew up in downtown Cleveland in an area where they didn't have the economic advantages to attend a school system and have the support that they needed to be successful, so that we can take that into account for that individual. The other part that I hope is effective for us is we've created a really inclusive campus here. And because of who we are and what we've been, applicants from all areas apply here in a much higher level than they used to. And so it draws from a big population of people that generally is it's reflective of Northeast Ohio in all of its regions. So it gives us the ability to have a population of candidates to come here who are reflective of Northeast Ohio, and we can use our definition that's compliant with law of educationally disadvantaged or rural or U.S. military connected to shape our student body to support what we do in the region. Now, I can't give everybody in the room the answer they want to hear. We're doing our best in a really dynamic set of changing or reinterpreted standards at the national and the state level. And we're trying to figure out how we can be compliant with doing what we think is best for our community, and hopefully allowing you to do what you need to do while we work on this. But it is changing. There is no right solution right now. There is no right interpretation right now. Many of these things are in federal court, and they're getting delayed through an TRO, which we learned today is legal speak for temporary restraining order. So some of these have not been implemented, and this is where you can go be an advocate through all the channels to see what you can do to try and bring a resolution in a way that you think is favorable from your individual perspectives. Now, SB 1, if it goes through the process that it's expected to go through, says that the university, and often they mean me, but they mean the university, may not comment on any of these issues of the day. So we have to stay silent. And Cayman, to your point, once it's law, I'm in a position where I can't even send emails out explaining anything that's considered a controversial issue of the day. In fact, Maria will be important for interpreting everything for me to say, how do we remain compliant? So we're facing the same challenges all of you are facing. We just don't know where things are going right now. And we're doing our best to be legally compliant and watching the landscape at the same time. Another question.
Okay. So I've heard that like the NEH is reducing funding to like 15% of indirect costs. How can you comment on how that's going to affect the institution?
I can. So the National Institutes of Health sent a letter out based on the CFR, that's Code of Federal Regulations, that they believe gives them the authority to unilaterally take whatever negotiated rate that institutions had for research and cut it to 15%, essentially effective immediately. So for NEOMED, that's about a $1.5 million financial hit. For Ohio State, that may be a $60 million financial hit. For Case Western Reserve, I believe the number is somewhere in the high 40 millions. Now, we're smaller, so as I think Dr. German would say, Our faculty punch higher, stronger for their weight than the others in many ways. So the loss per faculty member is actually greater at NEOMED. It's also been put on hold by a federal judge. There are numerous lawsuits going on. Now, there are a lot of tools at the discretion of the federal government that requires the executive branch and the legislative branches to interpret and implement. And of course, the judicial branch is always the mediator of, is this constitutional or not constitutional? And it gets well beyond my capabilities as a surgeon to weigh in on constitutional law, which is why we have legal experts to do so. But here's the thing. It's been put on hold, but even if it's not, NEOMED is committed to the research of our faculty. The overhead is meant to cover it's not to cover research. It's to cover the other costs associated with it. So a large number of our building space, it's dedicated to research. And basically, they don't want your tuition dollars to go to support those spaces. They want NIH dollars to support the work being done by the NIH. It's the maintenance of the building, the deferred maintenance, the operations, the electrical, the water supply, those elements. So they would be cutting us down from our negotiated rate of 57% to 15%. For CASE, I believe that's a 61% rate down to a 15%. We're going to continue to support research. It's part of our mission. And the impact, yeah, it's about $1.5 million a year to the university, but we're in a good position with our new partnerships that we can absorb this. We'll be okay. And you as a student should feel no difference in the research experiences that are offered to you. In fact, the new strategic plan refresh that we're just finishing up calls out specific increases in resourcing better and more impactful opportunities for students to engage in research and scholarship at the university. So we're working hard to take care of you. I'm going to go back to some of the online questions. How will you continue to support students in being culturally competent physicians while decreasing the amount of URIM on campus and slashing sessions? So we didn't say we're reducing anything. We just have to follow a new standard. And if we get a lot of really highly qualified URIM students who meet our diversity definitions, which are a legal form of the definition, I can't say that there's going to be a decrement. I don't know. That is up to our faculty who go through the process of admissions and selecting candidates while legally interpreting what the rules are right now. There's not going to be a decrement in number of the IMs applying nationwide. And I suspect many of them, but not all of them, will be educationally disadvantaged, right? To give an example, if you're the daughter of our former President Obama, you're probably not educationally disadvantaged or economically disadvantaged. So yes, that student wouldn't get some type of extra bonus point for the process of bringing people in. But I don't think that's what it was ever intended for. At the same time, if we have somebody from a different population set who normally wouldn't have been recognized under race, but happens to live in a really rural and economically depressed areas such as the Appalachians, we would recognize them as educationally disadvantaged. So I still think the intent and the purpose is still going to be applied. The other thing is, I've talked with Senator Serino, and he told us this is not meant to get away with social determinants of health and teaching in the classroom things that different populations experience because of the population they are from. That is not the intent of this. His comment was, this is really to make the universities give everybody the success tools they need to be very successful in the pursuit of their professions at the university and not to advantage one population over another. It is not to get rid of cultural determinants of health, social determinants of health. Dr. Basson in the College of Medicine and Dr. Trump in the College of Pharmacy, we had this very discussion today, and they are continuing to teach the science of healthcare. And it is just that. It is all science-based. We have the data to support it. We know certain populations respond to one medication or one therapy than another, and our students have to learn that because it makes them better at providing individualized care. At town halls, a partnership with the University of Miami was mentioned. Any updates? Yes, we're continuing to move forward. Miami will be out here tomorrow evening and all day Wednesday for a visit with us and some of our hospital partners and how we can shape the landscape to do what we do, workforce development in the region. We are partners with everybody who is interested in working with us to advance the state's needs. So we work, as you know, with SUMA and with Kent and with CSU, and we work a little bit with Ohio State. They do our back office for our clinic. And Miami came to us and wants to do something to advantage the state and our region in Northeast Ohio, and we're doing that also. So they have not made an announcement yet publicly on what their big new plans are, which does include NEOMED. And they've asked us not to get into some of the details until their board of trustees has authorized it. My board knows all the details through executive sessions. And when that time for an announcement is in, I would expect is coming soon, we'll announce it. We're still just as strong of partners with any of the other universities we work with. And this does not affect any of our partnerships with our clinical partners. In fact, it's been requested by them, and it will enhance them up in our region. Sorry, I have to be a little bit nebulous on that. I will be fully transparent when I'm allowed, but this is kind of under the equivalent of a non-disclosure agreement. But it will be good for the university in many, many ways. It was disappointing to not receive a communication from leadership about the significance of celebrating Black history and the great Black individuals who've continued in medicine and science. Black History Month is a national month. Black History Month can be celebrated at this university. We have areas for free speech, especially the area of the News Center. I believe it's taking place, and that's all great. We should recognize all different members of our society. This just happens to be a nationally designated month. So it's not that that won't happen and will continue. They're just telling us we can't spend dollars on specific items for it. But free speech and people congregating and coming together to celebrate is still what we do as people. So it may seem disappointed, but that isn't changing. There's still all kinds of different months that have been encoded into U.S. law that are recognized months to celebrate different populations across this great country that we live in. So that is not going away. It's simply, where can you use the university's financial resources, not your time and your willingness and interest in coming together to celebrate. Maria, would you comment on that any differently? Okay. So it's great that we have legal counsel here. So I just want to make sure I'm giving you the right answer. That's the way I see it. We are all allowed to still do these things. Free speech, the First Amendment has not gone away. It has not gone away and will not go away. I'm concerned with the requirements of SB 1 to list faculty names and office locations. It seems to target faculty who teach potentially controversial topics in current political movement. What are the university's plans to ensure safety and security? So first of all, we don't have anybody at this university teaching controversial topics. We teach science. We are a health and sciences university. If you are teaching something in the classroom that is not scientifically based as a health and sciences university, you might be teaching something you shouldn't be teaching. We are not here to editorialize on any of our political beliefs. We are here to teach students how to be great clinicians and scientists, and that's what we do. And it is all based on data. When we teach about social determinants of health, it's because we have data to demonstrate it has an impact on the delivery and the receipt of healthcare and the outcomes of patients. That is all fine. That is not what SB 1 is aimed at. You shouldn't really be worried. We have great security at this institution. There are cameras in many places. We have a wonderful police department. And I don't think we have any challenges in that area. We're also, all our faculty offices are behind badged areas, as are our student areas. The only places that are not badged security access are things in the news center, the gym, NEOMED Healthcare, and those are not areas where our faculty are contained. The governor's office and the chancellor's office is well aware of all these elements. There are a lot of things that we do have to do. So the state of Ohio has said your syllabus belongs to the university, and the university, you're part of the state of Ohio. So we're telling you that's our syllabus. So yes, you will post your syllabus so that we know it's being taught. Some have complained we shouldn't have to do this. This is our trade secret or the advantage as to why you come to Miami of Ohio versus the Ohio State University. The state is saying, we don't care. You work for us, and you do have to post these types of things. With the bill going through for state employees to return to work, eliminating work from home options, will NEOMED be looking at this? So right now, there is no policy that affects the university. It only affects centralized state government. Universities are not included in that. There is no work from home mandate for us right now. The federal government has gone to it. The state government has gone to it. Now, that doesn't mean that in the future there won't be a bill that says universities are included. For now, it hasn't happened, and the legislators have recognized that it's an advantage to the university in some very competitive fields where somebody wouldn't really need to be here necessarily to be able to thrive and run as a university. So we're not expecting that that's going to happen right now. Let me go back to in-audience questions. Cayman?
Hi, I had another question. So you talked about social determinants of health, and you also talked about how we have scientific evidence that social determinants of health impact care. So I guess, also as a student, obviously I don't do curriculum, but I know how it impacts me as a student. So I guess I just want to ask you, although we have this new legislation, is that going to trickle into our PPC courses and also our ability to bring people in who teach us about these things? I really valued, even last week we had a session about deafness. I really valued that and felt like it was very helpful for me to do care. And I also value the sessions that are race-based so that people can understand that people who look like me don't receive care properly. So, and I think that you guys also bring people in to do that. Like Dr. Elodie came in to do that. So I think I guess I just wanted to hear your opinion on and not just your opinion, just about what you guys are going to do to make sure that we keep that going, because it is really important. People have made comments to me as a Black woman that should not be made. People who are going to be taking care of people like me, especially, we have Akron in 20 minutes from us that has a high population of African-American people. We live right next to Cleveland, also high population and that's just two areas that are right next to us. So I guess I just wanted to hear about what the university is going to do to make sure that we keep those resources, and not only in academic settings, but also in other settings. I go to Iris for everything that I need. And it would be really unfortunate if a position like hers was not here, or the counselors, if they're not diverse. I'm concerned, and not only for me, but also for other students on campus. And I'm speaking from my perspective as a Black woman, but there's other perspectives out there that also should be considered, other races, other types of ability status that should also be considered, that I'm concerned about with this new legislation. So I was just wondering if you could comment on that.
I can comment on that. So again, we spent an hour today with the leadership team talking about this very topic. And the guidance we're getting right now from General Counsel and her interpretation, working on this with the state and also national leaders, and with the Dean of the College of Medicine and the College of Pharmacy, who are currently delivering clinical curriculum, is that this is all fine. The intent is to teach you how to be great healthcare providers for all the patients that you'll be taking care of. And you can't do that if you don't know and understand the impact of culture and social determinants in the acceptance and in the delivery of healthcare. And I say it that way because you can deliver it and not have it accepted by the patient because you don't understand the nuances of delivery of that care. So that is all still appropriate, and we are continued to do this and to support this. That was a comment Dr. Basson made today during the meeting, is that we have to do this. Now, there may be times where a student says, I'm not sure I want to be involved in this care. So for instance, people with certain religious convictions may say, I don't want to be involved in delivery of abortion care within a hospital. I don't think most of our hospitals actually deliver it, but for those that do, there could be a student who doesn't want to participate in it. And for the most part, participation, not participating in an event is allowed. Not learning about an event is not allowed. So if we're telling you, you have to understand the complications and the sociodynamic issues around a patient's decision-making, you need to learn that. We're not asking you to do, we're asking you or telling you you need to learn, because the faculty have decided that this is really important in your education. Now, our patients are different. I can have a patient come to me and say, Dr. Langell, I understand you're a surgeon and you probably deliver fine care. I'm not comfortable receiving my care from you because you're a man. And I have to respect that and say, let me see what I can do to get you to a colleague you're more comfortable with. And that could be applied to race, ethnicity, gender, and patients are allowed to do that. And it's our sworn duty to help them and get them to where they need their help. And we need to educate you on that too. So we don't expect, we're not planning on changing anything there. We enhance that. Many of our graduates say, this is what you do the best. In fact, I just met with a graduate who's an ophthalmologist last week down in Naples, Florida. And she said to me, so many people say, you seem like you're a psychiatrist and you're really good with people and the way to deliver care. And she said, that's because of where I went to medical school. But I'm an ophthalmologist. I am not a psychiatrist. So it's going to stay. And if there were any attacks on that and I felt otherwise, we would let you know about that. We would. It's not even on the horizon right now. And I've spoken to the legislature specifically on SB1, and they said, that is not the intent. Carlton.
Hi, my name is Carlton Cherry. I'm a P2 here at NEOMED. My question is more so because I've heard you use a term, I believe it's educational disadvantage, and I'm confused as to what that means. One of the main concerns that I have as far as the meaning of that is that, you know, even if you are President Obama's daughter, you could still face what some people may describe as like a implicit assumption of incompetence or like double standards and other barriers that can affect educational performance. Not only that, but then I want to know, will this, I guess like the criteria that is being used to field admissions applications, will that be published like on the website for people who are looking to apply so that they can know what to look for as they fill out their applications? And
Oh, go ahead.
and then a second question is what are you guys going to do to make sure that each and every student that's here at NEOMED feels as though they belong?
Thank you for the questions. So let me start with the middle one first. Dr. Faison worked with the leadership team to recreate the diversity policy in compliance with the law, and that is a published policy of the university. So students do know. And I understand your element of there could be implicit bias, right? That's race-based. Sure, it could happen. So what we do is say educationally disadvantaged, which is defined by the admissions committee, not by me and not by Dr. Faison. We leave that broadly to the faculty to determine what that means when they go through the process. But generally, that's intended to say, because of my individual unique circumstances, I was not given the access, similarly to this person over here, to be successful. when people write or discuss the issues of resiliency, they could say in a note to us or in their interview process or in their essays, while I did grow up in, let's say you grew up in Pepper Pike, Ohio, right? A nice area. And yes, my parents went to the country club. They probably wouldn't put all this in there. But if they did, you could also say, but I overcame these challenges and people didn't give me the same opportunity because they saw me differently. And they can use that perspective to be reviewed by the admissions committee and determine these other elements that are in there. But this leaves us compliant with the intent of state and federal law. And I think it's probably the fairest way to do it. So you may not be familiar with periodical that comes out nationwide that all the leaders at higher education institutions use. It's called the Chronicles of Higher Education. And in that letter, in that issue that came out about 7 months ago, after SCOTUS ruling was in place, a professor who happened to be an African-American man, a black man, at a prominent university said, I agree with this. I think it should be resiliency-based. There are people who are in my university, and we like to claim, and I won't mention their university's name, we like to claim how diverse we are, but his comment, I believe, was about 70% of them grew up in wealthy areas and had every advantage provided to them. And we're making a claim that we're diverse when maybe that's not what the intent was. He was the one who came out and said, you need to focus on resiliency. What did the individual experience that they have had to overcome in their lives? So this is what we have. We're doing our very best to reflect Northeast Ohio and all the people that make it up, regardless of race and creed and ethnicity and gender, and say, we want you. You are here. You're going to stay in the region, more likely, to serve the region, which is why we exist. And how can we make you successful through resources? So Dr. Faison's office is stepping up those resources. And in fact, the new strategic plan refresh, I just got done reviewing all the elements of it. It's supposed to be endorsed by, we hope, by the Board of Trustees in about a week. Has a lot of programs focused on providing success resources for our students to grow them, both in research and academics, in service, and then we're dedicated to the exceptional student experience. How can we build that out? We went and met with students from across the university and received input on the things that we need to be focused on, and they are in there. Thank you for the question, Carlton. How can we donate to personally support these student efforts? You can do that on your own. What we're being told is even our foundation can't do it. So organizations that want to support students based on race, gender, ethnicity, they can do so, and they can make a payment to the university to pay part of a scholarship, for instance. But what it's telling us is we can't bring those dollars into the foundation, and we can't use those going forward. And this is still complicated, and I rely on Maria for that, but she basically said, right now, everything that was in place before is okay. Everything going forward should not go to, I know you don't want to hear this, Sophie, but should not go to our foundation. You should do this as individuals, and you're allowed to do so. The universities are just not allowed to coordinate it and house it. Can NEOMED advocate as well? Well, we do. I was in Columbus last week, week before, and I met with the leadership of the House. I met with the leadership of the Senate. I met with the Chancellor of Higher Education. All the presidents got together in the University Council and discussed all of these elements. And we do advocate on the behalf of our students, and we advocate on behalf of our employees, our faculty, and our staff, which is why Senate Bill 1's been modified. In fact, they've just modified it again. And so Maria's noted that she has to go through it again because there's been line changes. And I'm told some of those were in response to universities saying, could you give us clarification on this, or could you reduce that? And they seem to be open to it, but it's our advocacy that gets us there. Can you directly address why you are implementing something not in law? Well, we haven't. The only thing we've done is we were out of compliance with law by not having a faculty workload policy, by not having a post-tenure review. Well, I'll stop on that one. Faculty workload policy was a requirement. And so when we had to go through the process of developing one, because we're out of compliance with state law, and in fact, we have been since 2016, at least 16, maybe a little bit earlier, we knew that the Senate Bill 83 was eventually going to go through. Now it's the Senate Bill 1. The reason it didn't, had nothing to do with whether the state wanted it. It had to do with politics between the House and the Senate. So we comprised one that was based on what others have done nationally, was fair and equitable for faculty, and would be under the category of the requirements of SB 1, then 83, because we knew it was coming, and we didn't want to go through all of this work, which took a couple of years, only to say, well, that was a waste of time, now we have to redo it. So what we have is compliant, and we're in a good position from that standpoint, and it is fair and equitable. We did everything we could for our faculty to make sure workload supported every aspect of our mission, and it's tied to our faculty empowerment plan. And that plan has been adopted by almost every faculty member now. There are a couple who have decided not to, but we took our faculty from being paid at really the numbers were 15th, 16th percentile nationwide to now 50th percentile, which is kind of where you'd like to see that bell curve. It shows before, now this, I get to say this predates me, that we weren't compensating our faculty appropriately. And now it's pretty hard to argue that we aren't, because we have a new faculty salary-based process that is based on national performance data, and it's really been beneficial to them. So if SB 1 passes and administration cannot say anything, how will the campus community know what changes are being instituted? That's a very good question, and I don't know the answer to that right now. It's going to require the attorneys to tell us once it's in law, okay, this is a controversial topic of the day, or this is not controversial and therefore you can speak on it. I'm not sure how we're going to navigate that process yet. I'm like you, we're not informed yet. We don't know what the ramifications of the law are. And I guarantee you, with as near certainty as I can, it's going to go before the courts and get contested. So just the very portion of it associated with unions predates me, but Maria and Mary, obviously well-informed when she was lieutenant governor on this, have noted that a no-strike clause went through the legislature before, I understand it passed, and it was found to be unconstitutional, and it went away. So stay tuned. Once something comes into place, there are immediately going to be lots of challenges, and we just have to watch as a state institution and do our best to comply with the rules in a way that is intended. I have no ability not to do that. Will ERGs like Women in NEOMED and Black Latinx continue to exist? Well, for now, people can exist in programs. So gender is excluded under the Office of Civil Rights element, and it is being contested right now. So as I understand it, it's on hold. Is that right, Maria? Right. Right. But the OCR has been contested already, hasn't it? Yeah, so it's actually on hold. But basically what it'll say is you can't give money or pay people salary time to work on those, but people can still do it themselves. You can still do it yourself. Faculty can volunteer their time themselves. I can volunteer my time myself. It just says that you're not allowed to use university financial resources to support one group over another. And in this case, for the OCR, it specifically just says race. So for women, gender, that's not included. Now, Senate Bill 1 does say we can't do it for gender. So the question we just talked about today was, for instance, wins. Does that have to go away? Well, it doesn't have to go away. If we do have women at NEOMED, it just may mean that you're going to meet on your lunchtime and we're not going to put salary or administrative support to it, because if we did, we'd be violating the law if and when that law comes into act. And we just don't know yet. A lot of unknowns at this point. We're doing our best. I'm trying to give you all the information as transparently, openly, and honestly as I can. My hands are tied, and we rely right now on the attorneys to give us their interpretation. And they all come together from across institutions, and they're meeting very, very regularly to figure out how we navigate this. Since you won't pay for chicken fingers at Black History Month, does this mean the same for Women's Month or Diwali? So I think Diwali, I don't know if you would call that race or ethnicity or culture-based. It'll may be a different law in place by then. But the students can still have their event and still raise funds for their event. We just can't pay for it at the university level. But you got to remember, every time we do at the university level, where's that money come from? It comes from student tuition. So the student tuition dollars go to pay for that, because that is our financial driver at the university. So people can still do the things they want to do. And I think the Diwali group puts on their own event, and they charge for the event, and they raise money for the event. Black History Month, that is, Dr. Faison's working on what that looks like right now. But I made the comment earlier today that we're not allowed to use university resources on it, but I'd be happy to throw some of my own personal money into it, and I asked the others in the leadership group to match some of it so that we can do it personally, and that is totally allowed, and that is totally compliant. So we'll figure this out. Just, you got to bear with us. We're still learning what it is we can do, and we have some things that are always possible in the future. So all of you in this room could walk out the door and say, you know what? I'm going to donate money to this particular group's on campus, and it'll be managed by that group outside of the university's coffers. And you're completely free to do that. You can support anybody you wish to individually. As a state institution in Ohio, but beyond that, nationally, all institutions are being held to this. It's not just NEOMED. To echo Carlton's thought and the question and comments, Black students at NEOMED don't feel seen or heard. This is not inclusive or safe environment. And quoting one Black person's opinion as the only opinion that exists is not sufficient. Also, with the new MCAT requirements, will educationally disadvantaged students even make it to the interview process? So I'm not sure what new MCAT requirements are being referred to. Mark, do you know? By the way, I was prepared. I knew this was going to be a very eventful morning, so it's been very eventful for us.
So we have no reason to think that anybody is going to, quote, not make it to the interview process. The MCAT requirements are what they are. We need students to be able to satisfy the admissions committee that they can make it through medical school. We don't believe that we do anyone a favor by admitting to medical school and having them fail out after 2 years and leaving the school with 2 years of debt. But educationally, economically disadvantaged students will certainly make it into the process, will make it through the process. And those are defined actually not by us, but by AMCAS themselves. There are specific criteria that are used that are completely objective that we use.
Thank you. And you heard one man's opinion today because he was here and spoke up. You also shouldn't say one individual, because while we had one man who brought it up, we've also have a woman who's been in the audience bringing it up, and we're getting multiple opinions. And we want to hear from you. Just understand that we're not in a position when it's law that we can violate the law, or violate the law and have every one of you, no matter what your background is, lose the ability to get financial aid and then suddenly be tossed out of a non-existent organization because we weren't able to get you through because financial aid wasn't available.
Hi, I'm sorry. I have one more question. So obviously, I think that the student body, not only students, but also staff online and here, obviously want to talk more about this. So I was wondering, this meeting was actually held when M1s have class, so they couldn't be here today. So I was wondering if maybe we could do another, and also it wasn't clear that this was going to be discussed at this university update. Like most of the stuff that was on the slides was for staff, most likely. So it wouldn't be an unfair assumption that they didn't know that this was going to be discussed at this meeting today. So I was wondering if like maybe the office or maybe after you guys release some sort of statement, regardless of whether you guys know what's going on or not, but some sort of statement to say, hey, this is what's going on. It might impact some of you. And also here's a space for you guys to maybe share some of your concerns. Because me and Carlton are only, and y'all are only 3 students. And like, I don't see a lot of other students in the crowd here today. So maybe potentially having that could be really helpful to make people feel supported and also heard who maybe couldn't be in attendance at the meeting today. And then secondly, I wanted to talk about funding. So I went to Cornell University for my undergrad, and we had check boxes designated for donors to be able to donate to certain organizations if they wanted their funds to go towards that. Is that something that we could potentially do for our organizations now that we're no longer getting funding from the Blue Fund, or now that we're no longer getting funding from the university? If we want donors, because there's a large population of alumni that want to donate to specifically to a group, to whatever the cause may be. So I was wondering if now, after that, this law has been put in place, if that could be something that could be discussed with having checkboxes so that they could give directly to us.
Yeah, so this is a complicated question. I'll start with that one and then get to your first question. So we as any university, not just NEOMED, none of them are allowed to use resources to do that. However, you as groups can reach out and get donations. They will not be tax deductible donations unless you, through your national organizations or independently, create yourself as a 501c3. Is that fair, Maria? Yeah. Otherwise, they're just making a donation to you, and it's because they want to make the donation, and it wouldn't be tax deductible unless you go through that process. But you can do that. Cornell's not going to be able to collect the money and do this anymore either. But you can do it individually. Yes, you can. And in fact, you can get your national organizations to do it and to house it and to send it out to you as organizations, but the universities can't manage it. Your first question, right now we're still trying to figure out what's going on, and there's so many lawsuits and so many barrages of new things coming out. We don't really know where we stand. And the intent of today was to do just what I did, which is to recognize people on the campus. Sometimes I'm a little bit smarter than people think. And I knew that this was going to be the big topic of the day. We didn't put that up here as the reason this meeting exists, because it's not. This meeting is just an informational meeting, and I knew I was going to get questions. That's what we intend to do. So we didn't publicize this to say we're going to talk about SB1 or we're going to talk about the OCR or NIH. But I mean, I knew this was going to come up. We're not ready right now, as I'm working with Maria, to figure out how do we message this to the university without getting you stirred up, only to find out that I told you a bunch of things and you become unhappy, and right now something's being contested in court, and a week later it all gets shut down and it just goes away. We're still watching as it's evolving. Now, Kent State sent a letter out to everybody, but it simply said, we understand your concern, but essentially we don't really know what's going on. We're here to support everybody. And okay, it may make you feel, I'm not sure that does anything for you. We really don't know. And I've done my best to say today, I can't comment on where things are going. Almost everything is being contested in federal court. And SB1 is almost certainly going to get contested in state court. I don't know where things are going to go. I can simply share with you what's been done and what's been said, and the fact that things are now being contested. So it's such a changing dynamic landscape. We're all in a position where we just don't know. And I don't even know what it is I'm going to be allowed to comment on in the future without consulting with Maria to say, am I allowed to talk about this? There are carve-outs. I am allowed to, they say it shouldn't be controversial, but I'm allowed to talk about U.S. war efforts and U.S. troops. But I can't talk about, under SB 1, things like the war efforts of Russia invading Ukraine or other elements. So that was made pretty clear to us that that is going to be the interpretation. And yes, in the past, we used to recognize, for instance, when Ukraine was attacked, we sent a letter out saying, we understand this can impact many people. This may have a significant impact on you as an individual. We have these resources available to you. And I think probably that's still okay because we're not declaring a position, but we're simply saying these events are going on in the world, and just know that we have counseling available at the university if you as an individual are impacted.
I sort of have a comment, but I think, and maybe the lawyer can help out, the previous bill at the state level that had changes to higher education, I don't think it was defeated by the courts, but through a voter referendum. And I think that's another way this bill could be challenged. But I guess whether it's the state level or the federal level, I appreciate all the time and effort you've taken today to talk about these particulars and parse out how NEOMED is addressing them. But my only comment is whether anybody likes it or not, what's happening is an attack on higher education. And I think we need to recognize that. And if there are initiatives like voter referendums, that's a way for everyone in this room to get involved.
Thank you. Yes, higher education is currently not held in high regard nationwide. You may have read some of the big studies that came out that showed the majority of Americans do not have faith in higher education. The majority of Americans don't think the value is there and would steer their children away from a bachelor's degree and into something else. Now, these are what people answered in large surveys. Is that what they would really do? I don't know. But higher education has a credibility issue right now. Now, that's not us. It would be pretty hard to argue that what we do is not credible. And there is state licensure and there's national tests that confirm the data that we teach is compliant with what people should know to graduate and be great clinicians and researchers. And then they go on to deliver care. So that attack really isn't aimed at NEOMED, but we are under the Ohio Department of Higher Education. And so we are looked at as one of the 14 public universities. We're getting a little bit of bystander effect. However, I will tell you that during proponent testimony, for those who don't know, when a bill gets pushed out in one of the chambers, one of the legislative chambers, they typically do proponent testimony. That's when people come in and say, this is a great bill and you should vote on it in committee. And they do opponent testimony when people who don't think it's a great bill come in and say why you shouldn't do it. Proponent testimony heavily pointed their fingers at medical schools across the nation as one of the biggest perpetrators of the violation of these rules they're trying to establish. And that was really aimed at critical race theory. We don't teach critical race theory. We teach social determinants of health. So we're not doing it, but they did have a physician nationally who came in and made the argument and pointed the finger at medical schools. So most of what we do, what I hear from the legislature is, oh, you're different, John. They always tell me that, you're different. You're a medical school. And I said, well, actually, we're more than a medical school. Yes, we have a medical school. And they say, yeah, we get it, but you're still different. Most of what we're doing really is not intended to apply to you. All right, how is taking away the funding from the SNMA student not implementing something that's not in law? Well, it's because the Department of Education, this is federal, and their Office of Civil Rights has come out and said, this isn't new law. You've just never been following it, and we've never held you to it before, that this is law and you're not supposed to be doing this. That's why. And until we figure out what we're going to do and what the courts are going to say, it's a precarious rope to walk, because if we say, you know what, the hell with them, they're not right, and this is probably never going to make it through the courts, and we do it, and they decide to audit it, They could come in and pull all our federal funding, and every student in here who relies on financial aid would suddenly have to go find some other university to go to, but that may still have financial aid available to them. It would shut us down. I'm sorry, it's just the reality. I'm not doing this. I'm telling you why we're trying to stay safe as an organization, because they have come down, and the letter, we can send the, Maria, we can send the letter out. It came from federal government. You can read it yourself. It's online. If you want to look it up, it's online. It is quite detailed. Okay, and then since our tuition has historically been going to support these DEI organizations, will our tuition be going down? So very little funds go to this, right? Very little funds go to this. Our students are great students, and they have organizations that receive co-curricular funding. Is Sandra in the room? No. The amount is going to be in the hundreds to maybe low thousands, like $1,000 type of thing. And it goes to all student organizations that are formally recognized and have a faculty mentor. So it really, no, it doesn't change much. However, the $1.5 million reduction from the NIH, that's going to be a hit to the university. So I've been working with the other presidents to get the state to step up and support higher education. The governor has always been a big advocate for higher education. However, because of what they're calling an austere budget, higher education is proposed in the governor's budget that's called the as introduced budget at flat funding for the next 2 years. Well, you may say, okay, you're going to get what you have now, but flat funding when there's 3% inflation means we're getting a 3% decrement and then another 3% decrement on top of it. So yeah, we're out there advocating to get the funding to support the universities and to support our students. And we are aggressively doing that right now. John Stiliana, who is our head of government relations, has been going out, knocking on doors. I was in Columbus meeting with legislators. And so, yeah, we're in a good position at the university right now. You've not read anything in the newspaper about us having a $40 million a year budget deficit or a $20 million a year budget deficit. And have you read that about almost all the others? Absolutely, you have. And we really attribute this to Lean Six Sigma, zero-based budgeting, operational excellence, because in 2019 and a few years prior, we were burning our reserves and we were essentially taking losses. We're not there anymore. And we've gotten rid of things that are not mission aligned, things that when I came here, you complained about and said, why are we supporting X when it's not even part of the university? And I said, well, you're absolutely right. And we stopped. It was there. We learned about it. We moved it on and said, we need to spend our resources on us and our mission, which is discovery, so research, innovation. It's academics supporting our students. And there's some community service elements in it too. Okay, I don't know how we're doing on time, but I'll get to one last question up here. SB1, over 200 people showed up in person and more than 800 individuals submitted testimony in opposition to the bill. Students in Ohio do not support the bill. We should listen to our students. Okay, well, that's great. We do listen to our students. I have no ability to do anything about this. The legislature did give everyone an opportunity to come in and voice their opinion. It went until past 11 o'clock at night, I'm told. But ultimately, they voted it in the very next day. And so, yes, but we're supportive of our students, but I can't change the state legal process. So while I empathize with you, I'm not sure, other than giving you an opportunity to have your comment heard, I'm not sure I can really do much more with that. Well, thank you for your time. I'm sorry, did I forget something? Oh, you look like you wanted to say you forgot something. Okay. So there's a Dear Colleague letter. We'll send that out so that you can see what we received from the federal government. In the meantime, let's just keep doing what we do well. Let's take care of our students. Let's support research on this campus and empower everybody to be successful. And as individuals in the community, you could and should advocate however you feel is appropriate. At the university level, We advocate on behalf of the university, and that means the students and the faculty and the staff who are here. So we'll keep you updated as we learn things, but it's just a dynamic, ever-changing landscape right now. And and I'm sure there'll be a barrage of new things coming our way in the next 2 weeks. It's what's happening everywhere. But thank you very much for your time today.